What is malaria? Malaria is a serious, sometimes viral disease caused by a parasite that commonly infects a certain type of mosquito, which feeds on humans. People who get malaria are typically very sick with high fevers, shaking chills, and flu-like illnesses. Although malaria can be a deadly disease, illness and death from malaria can easily be prevented. About 1,500 cases are diagnosed in the United States each year. Majority of these cases are from travelers who come from different countries which are at high risk of this transmission disease, mainly from the Sub-Saharan and the South Asia. This disease can affect anyone, starting with kids, adults, men, women. It does not discriminate.
Malaria was eliminated in the United States in the early 1950s. Malaria has an incubation period of 7 to 30 days. Without using preventative measures when leaving the country, you are at high risk of malaria. Since the incubation period is 7 to 30 days, it's highly recommended that you finish the preventative medications even after you return. There are 3.4 billion people at risk areas for malaria transmission. Health World Organization estimates that in 2013, malaria caused 198 million clinical episodes and 500,000 deaths.
Hi, this is Maggie. Hi. How are you? Maggie, today we're going to talk about malaria. And the reason as to why we brought the malaria is because malaria is not common in America, but in the Sub-Saharan, which is Africa, is very common. So we're checking to see how much of knowledge and who knows more of malaria in America. That way we can be able to bring the vaccines, and just in case we have a patient or anybody who's brought in, we know what to do with the patient. So do you know anything about malaria?
No, I know that mosquito, what to want.
That's good. And who is mostly affected?
I believe it's like high population in Africa.
High population in Africa. That's good, but it mostly affects children. It's actually most of the time it affects children. You know how, at least, what kind of population, how many people are affected every year? We can just to let you know, in, oh my God, I lost it. In 2015, we had 438,000 people affected in malaria. And in five years before that, it was 306,000 people that are affected. And most of these are children under 5 years old, right? Do you know how we prevent malaria? We have a vaccine, that's one. And also we can use insecticides because because of the insects. We spread the insecticide to be good. Okay, what do you think affects? How do you think malaria affects pregnant women?
Very negative.
Yeah, and actually it brings in maternal anemia for pregnant women. That's surprising, right? It can also bring spontaneous abortion for pregnant women. Premature delivery, that's another thing that it can bring. Okay? Also, what else do I have about malaria? Maggie. I think that's about it, Maggie. Thank you very much. Hi, this is Rose. Hi, Rose.
Hi, Grace.
You're doing a global health class, and we're trying to see how much people know about malaria in general. And can you tell me about yourself, more about yourself? Where are you from?
I was born in Kenya.
Born in
Africa,
Kenya.
And there's a lot of malaria there. Yeah.
So tell me about malaria. Tell me what you know about malaria.
I know it's caused by protozoa.
Uh-huh.
It gives you those signs and symptoms like flu. Yeah.
So do you know what causes it? You said it's protozoa, right?
Yeah.
Okay.
It's a parasite.
It's a parasite. You're very right. Okay. Do you know anything about malaria in pregnant women?
I have no idea. I've never heard of that.
Okay.
Don't they get malaria in Africa when they're pregnant?
Yes, they do. But malaria can cause anemia with pregnant women.
Do they die?
They don't die. They can cause malaria. They can cause anemia, premature.
Miscarriage?
They can cause miscarriage too. So that can affect that generation. Anything else you want to tell us about malaria?
I hate the disease. It's allergic to all the.
Is there any vaccinations in Kenya for malaria?
I've never heard of one.
Yeah.
But I left Kenya many years ago, so I'm not sure.
Did you ever have malaria yourself?
Yes, I'm allergic to all those drugs.
Oh, wow. What drugs did they give you?
The quinines, all the quinines I'm allergic to.
Malaria queen?
Yeah, all the quinines, yeah, that drugs.
Okay. Can you tell me some symptoms of malaria?
Chills, fever,
Chills, fever, flu-like illness?
yeah, flu-like illness.
Okay. Now, who is more at risk for malaria?
Children?
Children, that's very true. So you said you don't know if they have a vaccine to protect malaria, do they?
I don't know.
Okay. Now, if you go back to Africa and you're worried about malaria, when you're transferring, when you're moving here from here to Africa, do you take any protections?
I see my infectious disease and they give me medication to take for a month. I usually start them 2 weeks before I travel and then I continue until 2 weeks when I come back.
So you kind of, you're proactive.
I have the yellow card and I have to take those malaria drugs.
Okay.
Yes.
Thank you very much, Rose. As for prevention, we can do vector control, we can use insecticides, we can use netting around our beds, we can avoid areas of stagnant waters, we can use anti-malaria drugs, and of course we can use bird spray.